So, phase one strengthening basically begins with initiating a good muscle contraction with the ideas of trying to recruit as many muscle fibers as possible to protect the joint itself. So, the first thing that we're going to talk about is a quadricep exercise. This is a two-part exercise. The first part is called a quad set, and the second part is called a straight leg raise. In order to do the straight leg raise, you need to do a proper quad set. So the first thing that you're going to do is you're going to have the patient lay on their back, flex the opposite leg in order to put your pelvis in a good position. Next, what you're going to do is engage your abdominal muscles. The leg that's being worked is the leg that's straight. So what you want to do is think of pushing your knee down into the floor, flexing your toe to the ceiling, creating a good quadricep contraction. What you're going to do is you're going to hold that for 3 to 5 seconds and then relax. Contract isometrically, really trying to straighten the leg, engaging that quad. Hold for 3 to 5 seconds and relax. Once you feel like you can do that properly without losing that contraction, the next phase to that is the straight leg raise. So it's the same type of activity. First you initiate that quadricep contraction. And now what we're going to do is we're going to lift the leg straight up, about 12 inches off the ground, and then slowly lower the leg right back down. The key to this exercise is maintaining that contraction all the way up and also all the way down without losing any force behind that quadricep contraction. Okay. Now we're going to work on one of our phase one glute exercises. As I explained earlier, the glute is one of those muscles that does a lot of things in supporting the knee and proper knee health. So we're going to work on our abductors. So the idea is bend the bottom leg. Top leg is the leg that's working. What you want to do is, instead of going from a straight position, you actually want to extend your hip back just a little bit, just back beyond neutral. And then you're going to come straight on up and down. Straight up and down. After about 5 to 10 of these, you'll probably start to feel a little bit of fatigue in your glute muscle, which is exactly what you want to feel. Now, most common compensations are when people start to roll forward and the leg starts to come forward. Okay, that's one. So the most important thing is hip forward, leg back, good contraction. Also keeping the fundamentals of our first exercise, keeping your quadricep engaged throughout the entire motion. Okay, so squeeze your quad, straighten that leg, engage your glute by pushing your heel back beyond the plane of your body, and then you want to go straight up and straight down. Straight up and straight down. Next exercise, we're going to roll over onto our stomach, and this is working our glutes in another direction and also our hamstrings. So the idea is flex the toe, engage the quads, same basic premise of the last two exercises, and what you want to do is extend the hip up, squeeze for a second, and right back down. Up, squeeze for a second, and right back down.